Okay. Hi, everyone. My name is Dr. Kimberly Rogers. I am a primary care physician and I specialize in internal medicine, lifestyle medicine, and obesity medicine. And I'm so excited today to tell you all about my practice, RestoreMD Medical and Wellness. So, we are a, I'm sorry. With the PowerPoint. Okay. We are an integrated primary care, weight loss, and lifestyle medicine practice, utilizing an innovative direct care model to restore and simplify the doctor-patient relationship. So we're here to solve a problem, and the problem is the broken healthcare system. We have a huge problem in this country with healthcare. Almost half of Americans suffer from at least one chronic disease, and that number is going up. The United States is the most expensive healthcare system in the world, spending over $4 trillion a year and rising every year. And the other thing that's rising is the cost of health insurance. So even last year, it increased by 5.6%. And what that's leaving us with is a situation where people are struggling to afford their health care. Over 40% of people are having to make decisions like, am I able to afford my utilities this month, or am I going to be able to pick up my medications from the pharmacy? So you would think with such expensive care that at least patients would feel like they're getting a good quality experience, but unfortunately that couldn't be further from the truth. So all of us as patients are experiencing higher out-of-pocket costs. um, Forget about, trying to get a doctor's appointment, how long that takes. The wait times are crazy, especially in Delaware. When you do get in to see the doctor, you feel a lot of times like your visit is really rushed, and trying to get in touch with your doctor outside of the office appointments is next to impossible. So, what if I told you that at Restore MD Medical and Wellness, we offer an alternative model of care? So the traditional healthcare system has a lot of problems, and we help to solve many of them. So our patients have longer visits. They're able to get in same or next day for urgent issues. Our patients are able to call, email, or text me directly, and we offer huge savings on blood work, medications, and imaging for cash paid. So how is this possible? The solution is simple. Instead of a situation where you have a patient and a doctor having to interact with all these expensive, complicated third party systems like health insurance, admin, and regulators, we keep it simple. We eliminate all the third party, and we are able to restore the patient doctor relationship. And the way that we're able to do that is that the patient pays the PCP a low monthly membership fee, and the PCP is able to provide all inclusive care. And the word for this is direct primary care. So DPC, direct primary care, is actually a growing movement in the country. There are over 2,000 practices throughout the United States, and in the state of Delaware, there are actually about 7 or 8 practices. In Newcastle County, we're the third or the fourth practice. So our business model is very unique and is very simple. So there's two components: a monthly membership, a low monthly membership, and the fact that we do not bill insurance. Our monthly fees are very reasonable. So our patients pay $129 a month for direct primary care, and that's also all inclusive of weight loss and lifestyle medicine. Now, we also offer an additional service for people that are not our patients, but we do have a 6-month weight loss program for the general public, because I also am obesity medicine certified. So this is our business model. And in order to explain this, I have to kind of talk about the traditional healthcare system. So traditional healthcare is a fee-for-service model. And what that means is that revenue is generated by patient encounter. So you have to see patients in order to bill insurance and get reimbursed. However, what people don't realize is that every year the rate of insurance reimbursement is going down and the cost of running a practice is going up. And so what's happening is that primary care practices throughout Delaware and the United States are becoming not financially viable. That is contributing to the doctor shortage. So at RestoreMD, our two components help solve that problem. Having a monthly membership fee allows us to have a consistent revenue stream. So we don't have that pressure to squeeze 20 to 30 patients in a day. We are able to have a smaller patient panel because of this as well. And because we don't bill insurance, and what I want to emphasize is that even though we don't bill insurance, our patients that do have insurance are welcome to use it for anything outside of our office, like getting blood work, seeing specialists, etc. However, when you don't bill insurance, that actually allows much lower administrative burden. We don't have to hire a ton of employees for billing and coding and running after our reimbursement. That allows us to also be able to spend more time with patients because we don't have to waste time on administrative tasks. It also allows our overhead to be a lot lower than a typical practice. So most traditional primary care practices actually end up spending about 60 to 70% of their revenue on overhead, and that's a lot. So with our practice in direct primary care, that's about half of that. Again, that gives us less pressure to have to see a lot of patients. And because our overhead is low, we're able to pass along those cost savings to our patients with a more affordable membership fee compared to a typical concierge practice, which might also bill insurance. So our core features are as follows: primary care, full spectrum primary care, including acute visits, in-office procedures. And what's unique about us compared to other direct primary care practices in Delaware and nationwide is that as a lifestyle medicine and obesity medicine physician, I also offer medical weight loss and lifestyle medicine in addition to primary care, all for the same cost. So we also have those concierge-like benefits that I mentioned before with longer visits, a holistic approach. And the big thing is that insurance status does not matter. So whether or not patients have insurance, they can still get great quality care. We also have a unique benefit of cost savings. So we have access to 75% discount at LabCorp, and a wholesale medication dispensary. So patients actually can end up saving a ton of money, even if they do have insurance, by using our cash discount. We also don't charge copays or per visit fees, and that ends up leading patients to getting better access for us. Because of that, they don't have to go to the ER, the urgent care, if they need something, because they can get in with us the same and next day. So at the end of the day, what you end up with is a healthier patient, and that's always a lot cheaper. This is just a slide to kind of demonstrate some of the test discounts that we have. I wanted to just go into the labs. For example, of vitamin D, for the cash discount is almost $4. And for Medicare patients, vitamin D with insurance is $130. So that's crazy. So every patient can benefit from RestoreMD membership, whether or not they have insurance. And guess what? So can businesses. So a big benefit of RestoreMD is for employers who, of course, we know spend a lot of money providing health care for their employees. But these are some national statistics that show just how our model can benefit employers who might want to give their employees benefits, but maybe can't afford health insurance or are just looking for ways to kind of save. Because we can provide this type of care, if an employer were to pay a monthly membership, their employees are healthier and more productive, and they end up utilizing healthcare and saving money all around. So everybody's happy. So we have been open since January, and we've had a really good community reception so far. As you can see, we've had a few newspaper articles, and our patients have great feedback for our practice online. And so I think that's just a good sign of overall success and longevity for our practice. So the market forecast is definitely in our favor. First of all, there is a growing need for primary care, not just nationally, but Delaware is actually one of the worst states for primary care access. There is also an increasing popularity of direct primary care, and people are seeking out our practice just because of that model specifically. Also, as a practice that is providing obesity care, we know that 1 out of 3 Delawareans has obesity, and that number continues to increase. So we are definitely getting a lot of traction with our obesity management. And we know that more people are unable to afford insurance, and people have to drop insurance all the time. And so it's great to have an alternative type of practice that can provide care no matter what the insurance status is. So revenue and projections, we opened in January, initial investment of $85,000. And just to kind of compare, our traditional practice usually takes at least $500,000 or more for startup costs. Our monthly revenue at this point is over $8,000. We have about 75 primary care patients, and we have a number of patients in the weight loss program. Our rate of growth has been steady at around 5 to 10 patients a month. And we are expected to have a positive revenue by the end of Q3, and estimated monthly revenue by the end of this year should be almost $13,000 if we are meeting the same rate of growth. So what is it that we want to do in general? We want to contribute to increasing access to high quality primary care and wellness, and we want to make healthcare more affordable. We want to disrupt the system as we know it right now. Growth projections, we want to continue to increase our membership steadily. And in the future, we hope to expand and hire new healthcare providers, whether that's hiring a new PCP or hiring other kind of complementary services in our office, like acupuncture, dietitian. We think that there's a lot of opportunity for growth that way. Community building. As a health practice, we want to expand and provide health programs for the community, especially focusing on minority and underserved populations. Obviously, as a physician of color, that is something that is near and dear to my heart. So hopefully with any financial input that we are able to receive, we hope that we can increase our marketing budget, expanding our brand awareness to individuals and small businesses, which is an opportunity for us that we haven't really been able to tap into yet. And we hope to be able to reinvest in the community through programs and scholarships as well. So that is our practice. Thank you very much.